What corrective work do you provide the patient? Well, we do objective analysis first. We do digital posture analysis, static and stress digital x-rays, thermography, look at live blood cell analysis, 3 different nerve scans, a surface electromyography, a rolling thermoscan, and heart rate variability. So we do that as our general initial testing. We can also do at our Tijuana clinic a complete dental exam and a CBC or complete blood cell count. Now, that's the start, the objective analysis. Now, the corrective work, we're going to do post nerve scans and post blood analysis and post x-rays to document that we're fixing the problem. So the corrective work we're doing is we're doing structural and neurologic based corrections. Now, how many times a day do you adjust the patient? 3 to 4 times, separated by 90 minutes. And in between that, because the body works on 90-minute cycles, we have them do cross-crawl exercises to change, because the vertebrae is not out of place and we're not putting it in place. What we're doing, we're changing the position, motion, and communication. You have to change the sensory input from that vertebrae into the brain. And this changes the entire structure. Changes the muscles on either side of the spine called the paravertebrals that don't have conscious control, because it's not out and in place. You've got to change the entire structure. So the lordotic curves, kyphotic, you've got to restore that shock absorbing capability. Then you've got to change the biomechanics of the feet, the knees, and the hips. So 3 to 4 times a day, depending on what the patient is. And since we do post x-rays and post nerve scans and blood analysis based on 30 adjustments, that could be, 2.5 weeks of care, we get post x-rays. How long on average is the patient expected to come in for a consultation? It really depends. 2 weeks, we're pretty much going to be getting post x-rays, on average. So that way we've got the initial set of scan and x-rays. Then we have a second one to compare so we can see what's correcting and what's not, because there could be lifestyle factors or compliance issues with doing some of the corrective exercises. And the exercises we prescribe are ligamentous-based exercises. They're not to see how strong you are. This is to restore the normal curve. So it's very, very basic, simple stuff. And in severe cases, people will stay for 6 weeks or 2 months. It really depends on the severity of the case and how much damage there is. So a lot of upper motor neuron lesion patients, like, I can't really discuss that because this one, I could do it on our private site. But let's say they've had certain interventions, medical interventions, that are causing damage. And we have to regenerate the neurons in the brain. It's called neurogenesis, so neuroplasticity. So this is why, based on the severity or what it is, like Parkinson's, MS, autism, you've got to heal the gut. That can take 30 days. You got to change the sleep patterns. Okay, that can take a week. You can need to have them learn how to check their blood pressure, because a lot of people are coming in heavily medicated. The average American over 60 has taken 12 prescriptions, and that you cannot take 12 prescriptions and expect to recover. So I tell patients, look, don't take them all together. Separate them if you can by half hour or an hour. This way you're going to lessen some of the toxic effects. This is just common sense stuff your grandma would tell you. So corrective work, you've got to do an objective analysis. How many times a day? 3 to 4. A buddy of mine up in Washington sees them 9 times a day, but he has a different technique. And how long on average? 2.5 weeks. You could come in for 2 days, and that would give us the time to do all of the tests, the assessment, and you get one adjustment, and then you could plan on coming back. But man, 2.5 weeks, we're getting pre and post tested x-rays.